interaction. The mission of the Art of Living is to promote positive mental health. The Art of Living slogan, "Making Life a Celebration," clearly reflects the organization's approach to mental health. Mental health is not just a mere absence of disease. It is a positive approach to life. The Art of Living has touched the lives of 450 million people in 156 countries through its programs and service projects. The programs that the Art of Living offers have demonstrated benefits towards impacting global mental health issues, ranging from remediation of disease such as depression, anxiety, substance use, and trauma. Independent research has shown remission rates of up to 70% for depression within 2 to 4 weeks. Stress levels as measured by the hormone serum cortisol have reduced by 50% with regular practice of Sudarshan Kriya, a breathing technique taught at the Art of Living programs. Participants have reported 218% improvement in sleep. Research among youth participants have shown 76% reduction in anxiety levels. Through our programs, youth participants have experienced increased belongingness, mental strength, and enthusiasm. In other words, the Art of Living programs are geared towards a full human flourishing as indicated by happiness, optimism, social connection, self-esteem, and resilience. Results are universal, spanning across age, sex, culture, economies, to include such diverse backgrounds and groups as refugee youth in South Syria, to senior citizens in Canada, to veterans in Australia, Russia, and the USA. Now, let me introduce the moderator for this evening, Professor Ronnie Newman, an award-winning Harvard University-trained pioneering researcher in the field of mind-body medicine, whose work spans for more than 3 decades. She is currently the Director of Research and Health Promotion for the Art of Living North America and faculty for Nova Southeastern University's Lifelong Learning Institute in Florida, USA. Without further ado, I want to hand over the proceedings to Professor Newman, and I would like to welcome Gurudev Sri Ravi Shankar.
Thank you, Rajiv. It is truly an honor to serve as moderator for this esteemed panel of mental health advocates, and of course, Gurudev Sri Ravi Shankar, whose global activities have literally impacted millions of individuals' mental health and uplifted it in 5 continents across the globe. When I was asked to help create this panel, my first thought immediately was, what are the best evidence-based practices to eliminate suffering for treating depression, anxiety, addiction, trauma, and so on? Especially since, according to the World Health Organization, the #1 disability in the world is depression. And unfortunately, every 2 seconds, somebody attempts suicide and succeeds every 40 seconds. What's more than 10% of the world suffers from a mental health disorder, and the numbers are rising. So obviously, highlighting innovative best practices to eliminate suffering is essential. And on the heels of that thought came a second thought. How are we defining mental health? Is it simply alleviation of disease or infirmary? Well, fortunately, there is a growing awareness that mental health is more than that it is a state of flourishing and living one's full potential, and it has aptly been termed by the World Health Organization as positive mental health. And positive mental health focuses on all aspects of our life, our mental, emotional, social, and spiritual aspects. It encompasses flourishing, of focusing on the good life. In fact, creating the best life instead of simply relieving the bad. It focuses on bringing the life of people from fair to great, instead of primarily focusing on bringing the life of those suffering to average. and it encompasses positive emotions such as love, happiness, enthusiasm, inspiration, and positive states such as self-confidence, self-esteem, and resilience. And so today's event, focusing on mental health, truly is a cause for celebration. We are focusing on the most innovative best practices for alleviating suffering, as well as what can be done globally to create robust, vibrant, positive mental health. And so I'd like to start the celebration by introducing our first panelist, Dr. Farnaz Sharif from the United Kingdom. Welcome, Dr. Sharif. Dr. Sharif is as a physician in primary care setting in England. She is the medical director of the Medway and Swale Integrated Care Partnership and founding director of this extremely successful Manage Your Mind program. And impressively, I'd like to share with everybody that she has been awarded an honor titled Member of the Highest Order of the British Empire by the Queen of England for her pioneering service in mental health. Welcome, Dr. Sharif. And
thank you.
Dr. Sharif, we know that depression, anxiety, and stress are very costly in terms of human suffering and economic burden. You created an extraordinary program that addressed both aspects of this. Will you please share with us what you created and the success it has had?
Yes, happy to. So thank you very much, Ronnie, and for the very, very warm welcome, and to Gurudev and all the other panelists for inviting me here to contribute to this very important discussion. So Manage Your Mind is basically a program that was set up through the International Association for Human Values about 8 years ago. It's currently running in Kent in the southeast of England, and it's essentially a community-based health and well-being program that supports adults with low-level mental health conditions or symptoms, encouraging them to take responsibility for their own mental and emotional well-being. So over the course of about 8 weeks, people are taught very powerful breathing exercises, including the Sudarshan Kriya or Sky. And we also talk about improving cognitive processes, reinforcing positive behavioral strategies, so participants are able to use this life skill to manage their stress, reduce their levels of anxiety and depression, and so improve their personal and professional lives. We know that this program has had an impact not just on individuals, but on communities as a whole, because it had a full independent evaluation carried out by the University of Kent. They did 4 regular assessments at intervals over an 8-week period and used internationally validated tools. So we used the PHQ score to look at levels of depression, and we looked at GAD scores to look at levels of anxiety. And the results that were later published in the Primary Care Research and Development Journal showed that for those who completed 1 or more sessions of Manage Your Mind, their levels of anxiety and depression dropped by up to 30%.
Wow.
But for those, and for those who completed the entire 8-week program, their levels of anxiety and depression dropped by up to 80%. And with both of these groups, there were also a significant percentage of people that moved to recovery and showed a reliable improvement in their symptoms. So about 2 years ago, we also asked people if after having completed the Manage Your Mind program, they needed to go back to see their doctors for any mental health related symptoms. And 83% of them said they didn't have to because the program helped address their mental health needs sufficiently enough. So we also looked at things from a financial perspective. And when you look at how much it costs to see a doctor in a primary care setting in England, every month for 6 months, to be treated with a standard antidepressant during that time, and to access at least 6 counseling sessions over the same period, we estimate that if that same person had come to Manage Your Mind instead, we would have saved the National Health Service just over £1,000 per person on average. So after having demonstrated that this is a low-cost, effective intervention that is integrated really well with the community, with local and with healthcare authorities, our plan is now to scale this up, to use the same techniques, so the Sudarshan Kriya, to improve resilience, to reduce stress and burnout amongst our frontline workers, especially those working in healthcare fields. So there was a survey that was done in England in 2019 that showed that 80% of doctors were at very high risk of burnout. And with that background, the same doctors were hit with a pandemic, and a more recent survey shows that up to 50% exhibit signs of severe anxiety or depression. And we know that from previous pandemics, these effects can last up to 2 years. So my question really, Gurudev, is with the responsibility that healthcare professionals have in looking after the sick, especially during a crisis, how do we encourage them to look after their own mental and emotional well-being? Thank you.
Yes, Farnaz, it's wonderful seeing you. And on this Mental Health Day, it's very important for all of us to create awareness about mental health. Prevention is far better than cure. So we need not wait for people to get depressed in order to give them a solution. And here is where we have to be very active, and lifestyle changes. What are the things that you can add in your lifestyle? How you can broaden your vision so that you get less anxiety attacks, and before it's too late, you are able to manage your mental health. Like people go to gym to keep a robust body. In the same way, there are yoga studios. People have realized that it's not just physical fitness, but it also gives you mental fitness. And so people have started doing that. But still, that awareness is far less than what it should be. I feel like dental hygiene, we need to promote mental hygiene too. And that is the way we can help our population from slipping into this dark hole of depression, which unfortunately seemed to be happening much more during the COVID period. And because businesses are down, many people have lost their job. World over, there is a sense of vacuum, and they have to stay with the same family in lockdown for 2-3 months. So there is a lot of family disputes, and domestic violence has increased manifold. I think looking at all these scenarios, I feel it is very important to send a loud and strong message to the world population on this World Mental Health Day, that it is important to take care of your health. These awareness campaigns have done a lot in the world. Like we did for HIV, when world was facing this pandemic, very horrible thing about HIV and AIDS, there was voice everywhere that stood up and created awareness about it. And through that awareness, we were able to manage, spread of that AIDS virus to a large extent. In the same way, now with this pandemic, people are wearing masks, a lot of awareness has come. I think much more than any other diseases that has happened in the past, because there is a total lockdown, and the new normals have come up in society. And at this time, I think we will have to pay more attention for mental health. Number one, create awareness to people to keep the spirit high, and also help all those around who, when we look around, we see depressed faces, we should not walk away from them. We have to talk to them, get them. I think these things would help in easing the anxiety. Yeah.
Thank you very much, Gurudev.
Yes. You bring up the old expression, an ounce of prevention is worth a pound of cure. And I would say in this case, especially since these mental health disorders tend to repeat themselves even after treatment, that an ounce of prevention is worth 100 pounds of cure. And so now what I'd like to do is turn to Dr. Nan Kumar for an understanding of how programs like Manage Your Mind can produce such impressive results. Dr. Kumar is a professor of psychiatry and director of CARE, the Center for Advanced Research and Excellence in Neuromodulation for Mental Health at the All India Institute of Mental Sciences, which is the premier medical research institute in India. He is also the chief mentor of the Psychological First Aid Program in prisons in India and founder of the Mental Health Foundation. Welcome, Dr. Nan. It's a pleasure to have you. And will you please explain to us the physiological underpinnings of how holistic practices such as sky meditation can so powerfully influence a person's mental health? You're muted, Dr. Nan. Dr. Nan, you need to unmute yourself. There's a button in the corner, lower left-hand corner.
Thank you, Professor Roni. Am I audible now?
Yes, yes.
Yeah.
Welcome.
Thank you very much. I'm so privileged and honored today, to be connected with Sri Gurudev on this very special day and time. And for this, I express my deep gratitudes to Professor Anju Dhawan, my senior, and the organizers for the opportunity to be with the Sri. Sri, we all know that mental health is an integral and essential component of the health. And WHO says this, we all keep on saying that, in fact. And we in India has a very rich tradition of yoga, meditation, and other culturally rooted intervention that has been shown to be very, very effective in mental health promotion and also to improve the emotional and psychological resilience of the communities. Gurudev, we have seen by the research that the breathing technique, particularly sky, it is very, very effective in so many mental health conditions. And it is established by the research Sri Gurudev that it is very helpful, the sky, in modulating the autonomic nervous system. And once we are able to modulate the autonomic nervous system, we can manage the stress very well, and we can manage so many chronic conditions also. Significant research had also been done to show the effect of the sky in managing the community-based disaster in the management. And it is well established that this sky practice, the person who practices regular sky, it induces a physiological change in so many organs, glands, and autonomic nervous system, and it leads to various hormones that help in maintaining the well-being and the health. We know that Ujjayi is a very useful technique to activate our parasympathetic nervous system that can relax us. And Bhastrika is very important technique, very useful technique to know and the basic mechanism to how to modulate the ENS. And Bhastrika is very useful for the people with low energy and depression. Gurudev, what we have seen in India, in Indian context, recently published research what says that there is a proportional increase in the contribution of mental disorder in the total disease burden in India, and that is increased to 2.5% to 4.7% from 1990 to 2017. That's a huge number, in fact. But at the same time, we also see that there is an increased number of psychiatrists from 1990 to 2020. In 1990, the number of psychiatrists were approximately 3,500. In 2020, it is approximately 9,000. So it's more than double. But still, we are witnessing more number of suicide, more number of mental health problem, and lot of other things in society that is very unpleasant. In fact, like the violence, domestic violence, rape, gang rape. It's very, very unpleasant, and somewhere it is related to mental health. In fact, the way we think. So I personally feel, Gurudev, that increasing number of mental health professionals, perhaps they are good in managing mental disorder, perhaps, but not in preventing and promoting mental health. So, Gurudev, we would like to have some of your thought in this area. Personally, Gurudev, what I feel that we can empower people only through awareness, as we have very rightly mentioned. But awareness should be first on mental health, perhaps, then on mental illness, because majority of us are not aware about our own thoughts, feeling, action. And once we are aware about our own thought, feeling, action, we can perhaps guide others. And another thing is, Gurudev, that training is very, very important in my understanding. Once I say training, it's the training of mental health professionals at all level, ranging from psychiatrists to psychologists. If you look at our training also, perhaps the spiritual part is missing, and the resilience is lacking, perhaps, in our training program.
Yes, Dr. Nanda, you have said it correct. The training is important. Training with the knowledge that different components, different aspects of our life and different emotions, we have never been taught to understand our emotions. People usually say, don't get upset, don't get angry, but never teach them how not to. When you are angry, that's it. Now, you should not be angry, but still you get angry. Now, this is a sort of dilemma. You, you show them 10-story building and you don't show them where the lift or where the staircase is. So they see the building, but they don't know how to reach out to there. This is where our breathing makes a big impact. Our breath has that connection between our emotions, our state of mind, and the sensation that arise in the body. So if someone understands the connection between body, breath, and mind, they are able to have self-control, self-actualization. This lesson, if it is taught to young people, they'll be able to be more centered, be able to have a say over their negative emotions. This is one thing. The second thing is, there is a lot of prejudice about mental health. If someone is feeling low, not feeling so good, then, they don't admit that. Especially for men, they say, oh, you should not cry, you should not be emotional. So men is supposed to be very strong. So any emotion man expresses, it's considered to be weakness. So these prejudice or bias about mental health has to be done away with. This also can happen through awareness. Yeah.
Thank you,
Yes,
Gurudev.
over to you, Ronnie.
Thank you, Gurudev.
That. Thank you for that very important clarification. It certainly is essential that we reduce the stigma. And so on that note, I'd like to turn to Ms. Kim Kayora in Japan. Kim, are you with us? There's a typhoon on the way. I'm wondering if that has gotten her. Kim, are you with us? Kim?
Hi. Hi.
Okay, we can't see you, but we can hear you. So Kim is the director of the Holistic, welcome Kim. Kim is the director of the Holistic Education Practice Institute in Osaka, Japan, which has a focus on mental health care. She also teaches at Osaka University and was drawn into the mental health field in 1995. in response to the Great Eastern Japan earthquake, which killed 6,000 people and displaced 275,000. Since then, she has been facilitating workshops supporting caregivers throughout Japan. Welcome to you, Ms. Kayora. And we'd like to ask you, the current COVID pandemic has made us aware of the physical and emotional strain that healthcare providers face. Your experiences in the field of mental health have made you aware of another group of care providers who, while not formally labeled as care providers, still face the same stress and are at high risk for burnout. Will you please share with us your observations about the significant number of people who fall into this category and what can be done to support their mental health?
Okay.
Thank you, Kim. Go ahead.
Hi. Rooney-san, thank you so much. いけるかしら？声で聞こえてますか？ I am Kim Kayuri. I'm very honored to participate in such a wonderful program with Shuri-san today. いけてる？ I have been working on mental care for many years. Through this experience, I am convinced of the necessity of mental support for caregivers who take care of others. I call them caregivers or carers. Carers often suffer from physical and mental stress. Some even face burnout syndrome. Carers means not only professionals, such as doctors, nurses, and care workers, but also non-professionals looking after their own family members. Japan is an aging society. Many people have old parents at home in need of care and attention. Caring for family members is becoming a very heavy burden, or nuclear family, especially on female family members. Official data is not available on carers burnout in Japan, but 30% of professional caregivers leave their jobs within 3 years, and most of them don't want to come back to their job. Reason is they have very strong stress in their job. The mental problem of non-professional caregivers at home is also serious in Japan. During my workshop, I have observed many caregivers, whether professional or not, are under a lot of mental pressure. I organize workshops for carers. My workshop encourage participants to regain and feel of connectedness and togetherness through barriers such as eating, listening to music or singing, reading poems, stretching, having quiet, peaceful time, looking at the moon together. At the beginning, most participants are not very expressive, but after a series of sessions, they are starting to feel close to other participants and to express their emotion, and they became able to laugh and cry. At the end of workshop, participants said, I feel togetherness. My loneliness has been healed. My mental and physical energy has been refilled. I have decided not to quit, but to continue working. I was able to go back to my starting point where I want to be a good carer. It is important to include care for carers in my everyday life. Last year, I have 18 workshops for 700 participants. You need a lot of physical and mental energy to take care of people you love. If you use all of our energy in looking after others, you are likely to burn out. That is why it is very important to keep a good energy circulation. Good energy should be circulated through giving and receiving. How to keep a good circulation of energy during the pandemic, keeping connection with others, even in distance, is important. It is also necessary to connect to the nature, to feel ourselves in the nature, since the nature is a source of energy. Those who are engaged in caring for others need more energy of love. So it is very necessary to revitalize a good circulation of energy to care for carers. Thank you so much. My poor English. Thank you. Hi. My question to Shuri-san is how to get an energy from the nature in our artificial city life. Please tell me.
Wonderful, Sam. You are doing wonderful work. It is so much needed. It's so much needed in that part of the world. Let me congratulate you and wish you success in expanding your work there. You know, this is very, very important what you are doing, making people laugh. It's necessary. And you know, how do you connect with nature? I would say very simple. Be with nature. Spend some time with nature. Just this awareness. I cannot embroil myself in my small little world and open up and see the nature. I am part of this nature, this thought, these aphorisms, this awareness itself will help people to connect. Again, breathing. Here, breathing is very, very important tool. When you ask people to start breathing properly and learn some breathing exercise, it will definitely help them to connect to the nature. Yeah,
Very good.
wonderful.
Very good. Yes, and I second congratulations on the good and unending tireless work that you do to uplift all of your fellow citizens. And nationally recognized medical. Oh. Can you hear me now? Yes? Great. So now we turn to Dr. Abhimanyu Sood from Canada, who is a nationally recognized medical educator and advocate for solutions to the opioid crisis. He is assistant professor at the University of Toronto Faculty of Medicine and director of Safer Opioid Prescribing. His research focuses on the intersection of mental illness, substance use, chronic pain, and population health. He is also, in his spare time, president of the International Association for Human Values in Canada.
The birds come.
Dr. Sood, you've been conducting research using meditation and Sudarshan Kriya as important interventions for depression, chronic pain, and opioid use. Could you share some of your insights into population health approaches to mental illness?
Thank you, Ronnie. Good morning from Toronto, Canada, where it's Thanksgiving weekend. I wish I could share some of the beautiful fall colors here with you, but stuck inside right now. I'm very grateful and honored to be part of this important panel. And I'll hope to build on really some of the important words that have been shared already. We're all so aware that societies around the globe are suffering from high rates of mental illness. Gurudev, you've been raising this issue for decades now, so hopefully some of us here have been listening. This is not just an individual phenomenon, but is really a population level phenomenon. You know, just yesterday, I was reviewing the most recent data about the opioid crisis in Canada, and the data are startling. Amongst young people who have opioid dependence, 80% of boys and 64% of girls are living with another mental illness like depression or anxiety. And we see similarly high rates throughout the lifespan. So there's a pressing need for us to be able to tackle these issues at a population level, in addition to at the individual level. And this is building on Dr. Kumar's earlier comments, but even in a highly resourced country like Canada, the wait time to see a psychiatrist can be 6 to 12 months or even more. You know, of course, so one solution would be to train more psychiatrists, but here it takes 13 years after high school to train a psychiatrist. In these pandemic times, most of us don't know what our world is going to look like 13 days from now, let alone 13 years. So I'd like to take a few minutes to share some of the research I'm working on currently that aims to bridge this gap between individual health and population health interventions, and which investigates breathing practices and meditation really as population health interventions. When we evaluate health interventions, there's 3 primary characteristics we look at. For population health interventions, I'll add a 4th, which we can think of as like a supercharger for the first 3. The first is safety. You know, since any population health intervention, as Gurudev mentioned, is going to be delivered to a large group of people, some of whom are unwell, but many of whom are looking for ways to further improve their mental health, we need to ensure that a population health intervention is safe. We have to have a very low tolerance for any negative side effects, which of course is a threshold that meditation, Sudarshan Kriya, and other breathing practices definitely meet. The second characteristic we look for is effectiveness. You know, the intervention has to work. But because the intervention is going to be delivered to large parts of the population, even small effects at the individual level can have, at a population level, overall very large effects. The third characteristic we look at is efficiency. We need interventions that can be safely and effectively delivered to large numbers of people, or what we call scalability. Otherwise, we run into the same problem as before of not having enough people to be able to deliver the intervention. Likewise, if we can deliver these interventions by non-health professionals, it can be a real big boon for cost effectiveness. Because otherwise we are depending on health professionals to deliver meditation programs. That means that they're not able to deliver other important care that they're trained to do. But the last characteristic of a population health intervention is what I call the supercharger. And something that we often don't think about, which is the intentional building of the social fabric, the intentional creation of belongingness. You know, social isolation is a key and really sometimes devastating feature of mental illness, and frankly, really any illness in general. I see this all the time in my chronic pain practice, to the point where sometimes health providers are the only social connection that some people have. But that social connection becomes a true game changer if it is not only created as a byproduct of delivering some medicine or some therapy, but when it is purposefully and intentionally created in a way that allows people to experience a deep sense of belongingness. So we must build population health interventions that are not only safe, effective, and efficient, but also that intentionally and explicitly build belongingness. And I think this is kind of like a marriage of the physiological benefits that Dr. Kumar reviewed and the social and spiritual connection that Ms. Kayuri also beautifully described. And that is truly what makes meditation and breathing practices unique and powerful population health interventions. Thank you.
Beautiful. Do you have a question that you'd like to ask Sri Sri?
Of course I do. Gurudev, you have been addressing the mental health of people globally since at least the early 1980s. And in fact, before then, I want to know your honest opinion. How is our mental health globally now as compared to 40 years ago? Are we better off globally? Or have things like increasing social inequality, the way we use technology and other factors degraded our mental health?
Well, we don't know. 40 years ago, nobody had done research on mental health. In fact, people had ignored when the cases became worse, they just put him in a jail or in a mental hospital and forgot about them. Others, they had to bear the blunt in their own homes, in their own communities. But there is no evidence or record. But one thing we can say is when we were growing up, we have never heard schizophrenia or bipolar disorder. We can't say there was no, but definitely these days, I think we are getting into more these illnesses than before. That's again a guess because there is no solid evidence about it. But since there was a time where it was not much talked about, nor was known, but these days you hear everywhere these challenges facing our society. Yeah?
Thank you, Sri Sri. So it really speaks to the need for implementing these population-wide mental health strategies from every level, from eliminating human suffering to scalability, to practicality, to finance. And so now what I'd like to do is invite you all to welcome Dr. Toshiya Hoshino, who is a professor of international public policy and former vice president of Osaka University in Japan. Until very recently, in fact, until August of this year, he served 3 years as an ambassador to the United Nations, responsible for socioeconomic affairs, with a special emphasis on human security. He's also been a visiting scholar at top universities in the United States, Australia, China, and Korea. So our question for you, Dr. Hoshino, is that your work at the United Nations provided you with a broad perspective on global mental health. What insights did your work there provide regarding addressing the mental health of individuals globally? And what concrete prescriptions would you recommend?
Okay, thank you, Ronnie. Yes, I was in New York and worked as an ambassador of Japan to the United Nations, mainly in charge of socioeconomic affairs, covering key issues of SDGs, that is Sustainable Development Goals, ranging from development, environment, education, food, water, disaster risk reduction, etc. They are all related to mental health issues, actually. But the matters related to universal health coverage, or UHC, we say, was one of the my priority areas, which is to ensure that all people have access to needed health services of sufficient quality and affordability. We even organized a group of friends on mental health and well-being among interested member states to raise awareness and to discuss policies to help people under severe mental challenges in post-conflict or post-disaster context, for example. Now, under the COVID-19 pandemic, we need to focus more on mental health issues as people feel more anxiety, stress, loneliness, and isolation, as we can see. So this session is so timely and relevant, and particularly graced by the presence of Sri Sri. I'm very happy to be with you. And in view of this urgency and the seriousness of the mental health challenges of today, I would like to point out that mental health is not just a health concern, but it can be considered as a security challenge to the individuals and communities. Thus, the human security support approach that the government of Japan is actually advocating proves to be effective by providing protecting and empowering people in vulnerable situations and to improve all spectrum of their lives, livelihood, and dignity comprehensively and holistically. So you asked me about the concrete policies and what kind of prescriptions. Well, the human security support, which I say earlier, is for those with mental health challenges. I would propose to integrate all the relevant policy means from medical, not just medical, but to socio-economic and beyond. As Ronnie said, this mental health issue should be defined much, broadly. So the medical intervention is of course important when absolutely necessary, but people tend to consider mental health primarily a medical issue. But no, in my view, and the speakers before me also emphasized that we needed to define mental health in a much, much broader social context and cultivate more non-medical options on top of medical options, including spiritual support, before labeling people so-called patients, of medical disease at hospitals. We can support people or each other at home or in a community or everywhere if we try to exactly to uplift the spirit or our spirit to prevent the issues become even more serious. So I tended to emphasize the power of spirituality even at the meetings at the United Nations. One good example is the International Day of Yoga, as you all know, which was launched by the government of India with the great support of Sri Sri himself in 2015. And it was the project I and my wife, who is a yoga instructor, collaborated actively with my colleagues at the Indian mission for the past 3 years. That was an effective entry point for many who have never practiced yoga or in the world experiences eventually find a way to be more spiritual aware. So here lies a challenge. That is, people tend to overlook this variable spiritual dimension. So letting people have the entry point to seek the spiritual support to mental-based issues is to be very, very important. So if I may, I would like to pose a question to Sri Sri as I close my brief remarks. How can we awaken or draw the attention to the somewhat dormant or often underestimated spiritual dimension in people we come in contact with daily, and also on a large scale? We have programs. We heard of beautiful programs from my previous speakers like Farnaz, Dr. Kumar, Kim-san, and Abi. But what additional efforts we need to do to bring them, all people in, get them involved? Thank you very much.
Thank you, Dr. Toshiya-san. It's so nice to reconnect with you and for the wonderful work you have been doing and you have done in the past as well. I think it's a very, very relevant question. Often people confuse religion and spirituality. They are very religious, they think they are spiritual. We have to make this distinction between religion and spirituality. While religion is about your belief system, spirituality is about your state of mind. And so they are two different things. So you can follow any religious philosophy you love to, but the practices that would help your body, mind, complex and your spirit is something which is common, which does not come in conflict with your religious beliefs. Like yoga doesn't conflict with anyone's religious belief. So this clarity we have to bring to people, number one. Second is, in the name of spirituality, so many things happen which doesn't stand the test of science. Spirituality never shies away from science per se, because anything that is true, anything that is an authentic experience can always be uh, looked through the lens of science, and it will stand the test of science. It has to. only then it is true spirituality.
Mm.
This is the second thing. The third thing is, again, we have to see that it is not a luxury of few people, or it's a cure for some illness. It has to be a lifestyle which keeps you healthy and happy. Like nutrition, the knowledge of nutrition helps someone to keep their body healthy. People eat food even without the knowledge of nutrition, without an expert nutrition's, you know, uh, wisdom. So you can just carry on without knowing the aspects of your own life, then you don't get much out of it. But if you understand the energy, the force, the life that you are, it helps you to live in a very balanced state of mind and a healthy body. So again, we have to emphasize on one point: a strong mind can carry along a weak body, but not the other way around. A weak mind cannot carry along a strong body. Yeah. And so, as you correctly said, the awareness in people, the entry point for people has already been there. 2 billion people today are practicing yoga, which was not the case some 40 years back. So it's a very good change that is happening in the world. But at the same time, we will have to, the stigma on mental health is something that is still uh, is there, very much there, that need to be overcome. Yeah.
Mhm. Thank you very much.
Thank you. And let's now move on to our final speaker, which is Ms. Emilia Lahti, who is a PhD candidate at Aalto University in Finland with a background in applied positive psychology. Amelia researches inner fortitude and trains individuals in what she has termed gentle power, which is an expression of inner power and strong leadership that is harmonious, graceful, and helps elevate the human family. Amelia, welcome. And with your background in applied positive psychology and your research in inner fortitude, will you please give us what recommendations you can offer to us for elevating mental health globally?
So thank you so much, our beloved panelists and Sri, Ronnie, all the listeners. It's an honor to be here. I'm very excited. So very briefly about positive psychology, which is about recognizing and really scientifically investigating all the tools about that relate and that support mental health. It's about focusing on what is good in humans. So it rests on these two premises, which one of them is that wellness is not simply the lack of illness. And then secondly, it is about enhancing that which is working and which is good, not going and fixing what's broken and focusing on the pathology. And besides being a scientific body of work, positive psychology also it invites our gaze to the horizon and to a hope that there is a new sun rising despite any adversities we might be witnessing in our lives. And it gives us tools to understand that we humans, as a result of millions of years of programming, we have what is called a negativity bias. So it's very natural for us to focus on what is not working. It served us and it has survival value. But within positive psychology, for example, tools related to gratitude, keeping a gratitude diary, it helps focus, bring our attention to what is working, what is good, who are the people who are helping you. Optimism is one of the most researched topics within psychology. Optimism means that we expect something good to happen in our lives. And sometimes it might mean that we will cognitively reappraise a moment. That for me personally has been one of the most powerful tools when I've gone through my own personal trauma and rebuilding from there. So rephrasing a moment to see, for example, what can I learn from this moment? And it means to invite curiosity to the conversation. It might be very hard to go immediately from pain or anxiety to happiness and meaning, but simply to a little bit open the door that what can I learn? What is the full picture of this thing? And it doesn't mean to push aside all the emotions, like the negative emotions, but it really just opens the space for the whole palette of the human experience. That's been very helpful to me. One topic that I really want to draw our attention to is that has been researched a lot, and it's significantly supported by science, which is the power of volunteering, which is the power of serving our fellow humans, which it connects with physical and mental health, happiness, life satisfaction, with less psychological distress, less symptoms of depression, even rates of mortality. So we live longer when we volunteer and we serve. And I've loved the beautiful examples that I've seen here of us, what we're doing. So that's very important. My number one advice, what I would say, based on research, based on my own experience, is to, whatever we choose, we can choose breathing, that has been mentioned, rephrasing a situation, for example, or we can choose community volunteering, we can choose gratitude, optimism, but choose even just one tool and really commit to practicing it. It's really like bodybuilding. We must go to the gym, and even if it's just one of the tools, I bet it's going to take us really far, and it's not going to get too destructive with too many things. So my question to Sri is that I understand very clearly that to be a force for good in this world, the work starts with my commitment to myself. But at the same time, it can be hard to be a force for good sometimes because of past trauma, because of ego, because of not very encouraging leadership examples that we might see. But what is your most practical, useful, and foolproof tool for dealing with negative emotions when they come, such as anger, judgment, and harshness? Like, what is something that can easily bring us back to gentle power and gentleness in our lives? Thank you.
Yeah, wonderful, Emilia. I think you are answering your own question. You have already said, instead of sitting and thinking, what about me? If you get out and continue to engage in service to others, always see what is needed to be done rather than what people are doing. So it saves our own mind to a great extent. We will be able to manage our own emotions and safeguard our mind. This is where the wisdom or knowledge or seeing life from a broader perspective would help an individual to be more stable in their own emotions and feel the purposefulness in their actions. Yeah. Wonderful, Rani. You have done a great job as moderator, and all the panelists are very nice. I had to rush to another session now, so wonderful. You can carry on for a few more questions among yourself you have to discuss. But I say bye to all of you.
Thank you, Sri, and thank you so much. We're all so grateful for the light that you shine and how it uplifts humanity everywhere. Thank you so much. And I'd like to thank all of our panelists for showing us ways that we can cast a broader net on uplifting all of humanity. And so with that, I'd like to again thank all of our viewers, our esteemed panel, and also everybody who just jumped in.
Thank you.
As Amelia said,
本当にありがとう。
use one thing and just do it. Thank you very much. Blessings to all. Here's to everybody's robust, vibrant mental health and a life very well worth living. Thank you all. Bye for now.
Oh.